Welcome and very good evening, dear doctors. Today we are going to discuss on the multiple choice question from the previous years, and our today's topic is on medicine, and specifically we are discussing on the intensity of the first sound and the related conditions. Okay, so let's start our session. Here is the question. The disappearance of the loud S1 in mitral stenosis occurs in all except. Here are the options. Option A, first degree heart block. Option B, aortic regurgitation. Option C, calcified valve. And option D, mild mitral stenosis. So read the option carefully and find out the answer. So the right answer is option D, mild mitral stenosis. Yes, you can see the loud S1 in case of mild mitral stenosis, and the rest other condition, that is the first degree heart block, aortic regurgitation and calcified valves, are associated with disappearance of the loud S1 or soft S1 actually in mitral stenosis. Okay, so let's dive into the discussion. So actually the major components of the heart sounds are due to the vibration associated with the abrupt acceleration and deceleration, specifically deceleration of the blood in the cardiovascular system. This is the basic actual. And as you all know that the typical heart sounds are produced due to the closure of the atrioventricular and the semilunar valve. The first heart sound due to the closure of the atrioventricular valve, and the second heart sound is produced due to the closure of the semilunar valve. And as you all know that in first heart sound having two components, mitral component and the tricuspid component, and mitral component is usually closed first, followed by the tricuspid component. And normal splitting of the first heart sound is in between 10 to 30 millisecond. This is a normal phenomenon, and it can be seen in very healthy normal patient or normal individual or individual with thin wall, and typically the mitral component is can be hard in the at the apex, and the tricuspid one that are on the lower sternal border. Okay, so all those are the basic. So let's find out the causes of the intensity of the first heart sound. They can be both physiological and pathological. So what are the causes of intensity of the first heart sound? Number one, the position of the mitral valve reflect during the onset of ventricular systole. This is very important. Number two, the rate of rise of the left ventricular pressure. If this is abrupt, this might lead to the louder first heart sound, as you can in the presence of the normal mitral valve. Number three, that is the amount of tissue, fluid or air in between the stethoscope and the patient and the heart, or the components of the cardiovascular system, heart actually. A different condition that may lead to the intervening tissue or fluid or air in between the stethoscope and the heart, like mechanical ventilation. In mechanical ventilation, in pneumothorax, pericardial effusion, obesity, the distance is increased, and this leads to the This can lead to the soft S1 or Fusser sound. And number 4, that is the structural abnormalities or presence or absence of the structural abnormalities of the mitral valve. As in this case, in mitral stenosis, interesting things happen related to the intensity of the Fusser sound. In mild mitral stenosis, the leaflets are still mobile. The high left atrial pressure keeps the mitral leaflets widely open until the very onset of ventricular systole or isovolumetric contraction. And as the valve then snaps, start from the wide open position against the high pressure gradient, and this will produce a loud snapping S1 or first sound. And this is the basic why the mild mitral stenosis having the loud S1. But in case of the predominant mitral stenosis, the valve is open immobile due to the underlying pathological process, and this will lead to the soft S1. So let's clarify the other options, why the S1 softens or disappears in other condition like first degree heart block. First degree heart block, as you all know, is associated with prolonged PR interval, and this will allow what? The valve leaflets to float back to a semi-closed position before the ventricular systole begins, resulting in a soft S1. There is no abrupt closure or snaps. In aortic regurgitation, the regurgitant jet prematurely closes the mitral valve or reduces the closing force, and this is also called the Austin-Flint phenomenon. Try to memorize this. And this will cause the softening of the S1. In option C, there is a calcified valve. Why? It is due to the mechanical issue. The severe calcification creates a rigid, immobile valve that cannot snap shut, leading to a soft or absent S1. So here is an interesting thing related to the auscultatory triad of the mitral stenosis, and you should know this part, and it will help in your day-to-day. It will help to diagnose the cases of mitral stenosis. The typical triad of the mitral valve. Classic finding in pure pliable mitral stenosis. Number 1, the loud S1 or the tapping apex beat. Number 2, the opening snap or the opening snap OS. And number 3, the mid-systolic rumbling murmur with pre-systolic accentuation. This is a typical auscultatory triad of the mitral stenosis. Try to memorize it. It will help in your future exam. Another interesting fact related to the S1 or Fusser sound, that is the reverse splitting. Normally the mitral valve closes first, followed by the tricuspid valve. But there are some conditions that are associated with reverse splitting, means tricuspid valve, the tricuspid component closes, followed by the mitral valve. And what are these conditions? Number 1, left atrial myxoma. Number 2, LBB or left bundle branch block, and the related, and all those are responsible for the reverse splitting. This is the interesting facts, and you should know for your knowledge. Okay. So this is all about today's session, and welcome to AiMedTech. Myself, Dr. Ratul Basu. Stay strategic, stay focused, and we'll meet you soon. Have a good day.